Hello, so today I'm going to talk about another question that I got from a patient last week. So whenever I'm treating, we've got Sydney in the room here at the moment looking very dashing in his winter gear. Now the question was, my patient looked at Sydney and she was having problems with her low back and looked at the lumbar spine, the bottom vertebra of Sydney here and said, well, it's no wonder I'm having trouble if that's all that's holding me up. Now, when we look at the skeleton and we think of the skeleton as like the structural support that's kind of holding us upright, when we look at Sydney and we look at that makes sense. You know, of course we're going to have problems with that if that's all that's holding us up. The thing is that it isn't all that's holding us up. You know, kind of sometimes mechanically it kind of looks that way, but it isn't. And you've probably heard of the thing that actually is kind of helping our spine to hold us up, and that's our core, so core stability muscles. Now, the core stability muscles aren't just like this sort of six-pack that everyone sort of thinks about and think, right, I must go and do some sit-ups to work on my core muscles. In fact, we get loads of patients that say that, you know, New Year's resolutions particularly, oh, you know, I've got weak core, I keep having back problems, so I've been doing some sit-ups. Sit-ups are the worst exercise to do for your core because your core muscles are there to help you balance and stabilise. When you lie down on the floor, all of those muscles switch straight off. And when you do a sit-up, you go from them being switched off in an extended position when you're lying on the ground to them suddenly all switching on again and your back kind of having to be stabilised. So it's not that great, and people do get injured doing sit-ups when they're not kind of particularly fit to do it. So the core muscles aren't just kind of these abdominal muscles there. They're like a wrapper that come all the way around here and deep inside the abdomen and spine as well. Now we can really think, those get called the core stability muscles, but we can really think of core stability or stability in any part of the body or joint. Any kind of muscle that's stabilising us when we're going through a movement is a stability muscle. Now, the reason why these core muscles are so important is for just that reason, that this spine here isn't the only thing that's holding us upright. If we kind of think of all of these muscles that are wrapped around this cavity here, we've got the diaphragm at the top, our main muscle for breathing. We've got those pelvic floor muscles at the right, sort of at the base here, and then all of those muscles wrapped around. They make like a sealed kind of cylinder that helps hold us upright. And a good way of thinking of that is to look at a bottle or a can or anything like that. When it's sealed, it's quite strong. You can't compress it, you know, you squeeze it, you can't sort of bend it or twist it. It's really quite strong. It's like a sealed, encapsulated unit, like if we've got a strong core that's stabilising our back. Now, if we're to break that seal, then actually it becomes a lot weaker. You know, we can then bend it, we can distort it, we can sort of squish it and damage it a little bit, and you know, just like that. Whereas again, if we seal it, then it becomes a lot stronger again, and we can't distort it like that. And that's kind of the way that our core works, that if we've got those muscles that are actively working to stabilize us and keep that sealed unit, then our spine doesn't have to do much in the way of kind of holding a load. In fact, our spine's much better designed for kind of guiding movement. If the core is working, then the spine shouldn't have to do that much weight bearing at all. In fact, it's not particularly well designed for kind of weight bearing on its own. A lot of the spinal joints are about the size of your fingernail, which, you know, isn't kind of a massive area to bear the load of your whole body above that. So lots of the time we kind of think, oh, you know, especially kind of patients come in, they say, oh, you know, it's inevitable, you know, I'm getting old now, I'm going to have some wear and tear. Well, you know, no. If that was the case, if our spine just kind of does wear out with use, then the more that we're using these things, then the less we should be getting that wear and tear. And we're not. Actually, the more sedentary lifestyle that people are leading, the more they're sitting down, then the worse that wear and tear is getting. And that's not because that they're using their spine more or it wears with use. It doesn't. It's wearing because it's not being stabilised, so it's not being used in the correct way. Tools don't wear out if you use them properly, so look after your tools. That's it for today.